Senator Blunt, Rochester.
Thank you, Mr. Chairman, and thank you, Director Bhattacharya, for being here today. I want to start by saying I was really pleased to hear you, as the head of the NIH, encourage parents to vaccinate their children for measles, especially in light of the outbreaks in Texas and South Carolina, so thank you for that. On Monday, January 5th, 2026, the CDC Acting Director, Jim O'Neill, announced an immediate and sweeping overhaul of the child and adolescent vaccine schedule after signing off on a decision memo requesting this change from you, CMS Administrator Oz, and FDA Commissioner Mukari. Is that correct?
Yes.
The new vaccine schedule downgrades the recommendation of vaccines for all children from 17 diseases to 11. Historically, this type of decision would have been made through the public process of convening the ACIP. So since this is kind of out of the norm, very out of the norm, I wanted to ask you a few questions about the process and outcomes. First, how many fewer children are you projecting will be vaccinated due to this change?
I expect more children to be vaccinated due to this change, not fewer.
And if you can you share the analysis or study that demonstrates that more children will be vaccinated?
It's a question of public trust, Senator. I've watched.
Was there a study?
I mean, we did. Yes, there was a study. It was just released with this. Part of the decision memo was a study of the vaccination schedules, and the key idea underlying the.
Can you share it? I only have a little bit of time, and I got a lot of questions. Could you just share that study with us? That would be.
Yeah, I think that was publicly released, but happy to share the study.
Okay, great. And in that analysis, how many more children will be diagnosed with meningitis or hepatitis or the flu?
Again, I think that there will be more children vaccinated as a result of the change, not fewer.
Did you recommend any type of plan to measure the impact of the changes to this childhood vaccine schedule on health outcomes?
I mean, the CDC tracks that carefully. So those measures will be released publicly, just as the CDC always does.
And we know that specific vaccination rates must be met to prevent outbreaks. So it seems very reasonable that this is something that would have or should have been evaluated before making that kind of sweeping decision. Your memo notes that the changes were made after, quote, careful review of the current vaccine schedule, peer nation schedules, and best practices. And these are just a couple of yes or no questions. Did you consider the unique patterns and causes of disease in each region, like the U.S. versus Europe?
I mean, I'm not the author of that memo itself. Of course,
so you're not.
But no, I mean, I read the memo very, very carefully. I mean, it was a careful analysis of the vaccine schedules of other countries, of our peer nations, the Danish schedules, the Scandinavian other Scandinavian countries.
I'm going to get to that. In that assessment, do we look at the differences in pre- and postnatal, pediatric and primary care, or consider maternity leave policies, or health insurance, or healthcare workforce?
I mean, we considered that there are differences in healthcare policies, absolutely. This memo considered there are differences in healthcare policies, absolutely. I think there's a fallacy here, right? The idea that Americans have different ways of accessing healthcare than Scandinavians, and in some ways Scandinavians it might be easier. That makes it harder for Americans. If you want to have a larger vaccine schedule, in the context of Americans having more difficulty getting access to healthcare, you essentially making parents feel guilty over things that they don't have control over.
Well, it was just strange to me that we're comparing ourselves to Denmark as a peer nation. Denmark has 6 million people. We have 340 million people from all walks of life. That's like 57 times larger. Denmark has socialized medicine and universal health care. The United States does not. Parents in Denmark are entitled to paid parental leave. In the U.S., this is not guaranteed. So I'm trying to understand the comparison of Denmark to the United States, with the exception that they have one of the lowest recommended vaccine rate vaccines.
I think the key thing in Denmark is that they have strong public trust in public health. That's what we're trying to do, is reestablish that public trust, because the vaccination rates responds, and there's a ton of literature on this, the vaccination rate responds very sensitively to the level of public trust in public health.
I totally agree with you on the public trust piece, and I think that's what is concerning me, is that instead of modernizing, we're actually going backwards to a time when we didn't even have vaccines. So to me, it's very important that we be really clear about the science. I look forward to you sharing